Hey guys, what's going on? This is John from Friends of Your Benefits. Did you know that over 37 million Americans have some form of kidney disease, yet over 90% of people with kidney disease don't actually know they have it? How can that possibly be, and what can you do to make sure your kidney health is where it needs to be? Joining us today to learn more about kidney health and what you can do, we have Sara Eve Schaeffer, a registered dietitian and self proclaimed kidney nerd. Hey, Sara Eve, how's it going? Welcome to the show.
Hey, John, thanks for having me. I'm really happy to be here and talk about kidneys.
Absolutely. So, Sara Eve, why don't you tell our audience a little bit about your background and how you know so much about kidney health?
Sure. So, when I was a new registered dietitian, they recommend that you start working in the hospital. And so that's what I did. I'd wanted to go into public health nutrition. And soon after working in the hospital, there was actually an acute dialysis unit that had a dietitian. She went out and leave, and I was the next up at bat. And I just loved it. I loved the relationships. I loved getting to know the patients. I loved the value of nutrition. And it was a perfect match for my energy and what my passions were. And it's just kind of grown organically since then.
So, you love all things kidney.
I do. I really do. And I think part of it is I like it because it is an underdog story. I think we'll talk about some of that, but it really is something that doesn't get the attention that it should. And so I feel like that's part of my journey is telling more people about their kidneys and kidney disease.
Absolutely. So, why don't we start with some basics? What do your kidneys actually do?
Yeah. So, first of all, you should give your kidneys some love because we don't think about them often, but they do a whole lot. And you really notice that when they aren't working. So, right, kidneys do the first thing we think about, right, is they concentrate our urine, right? They allow us to excrete metabolites from our diet and what we eat and drugs and filter that. And then obviously urinate those things out, right? We don't want all of that building up in the body, but they also control the sodium and potassium, which right the movement of these minerals across the cell membrane is really what causes cells to fire. So it's really critical for life that your kidneys are working. They also balance your body fluid, your blood pressure. They regulate your activation of vitamin D. They control your red blood cell production. There's a lot of really small nuances they do in the body that actually make a huge difference to your overall health.
Sounds like kidneys definitely do a lot more than I thought, to be honest with you. So, follow up question on that. So, how do you know if your kidneys are actually healthy, right? Like, I mean, I feel like kidney health is one of those things that kind of gets a second seat compared to heart disease, diabetes, some of the classic conditions and unfortunate, conditions out there. So, what's your take on that?
Sure. So I think, right, we have to think about all the things the kidney does. If the kidneys aren't working, all of those things are a little bit out of whack. And don't forget, in the body, right, all the systems are interconnected. So if there's an issue with one area, it's going to show up in other areas of your body. And so as kidney disease progresses, the body will take on more and more stress, and more things will be out of whack based on that decreasing kidney function. And so then we think about, right, you're going to have bone and mineral issues. You're going to have a lot of cardiovascular issues. There's going to be issues with fluid volume, holding on to fluid. And it really is this kind of cardio-renal mix that really, kind of is a runaway train without intervention. And so I think and often, right, the two leading causes of kidney disease are uncontrolled hypertension and diabetes.
Hmm.
And while those seem like smaller conditions and manageable conditions, they require kind of constant upkeep. And if you're not able to do that, then the kidneys can just keep losing function. And that's where we see folks really progressing through, the stages of kidney disease from stage 1 and 2, where you might not have much effect on your body systems. And then 3, 4, and then once you're in 5, you require some sort of renal replacement therapy, to live, to be alive.
Sure. So, one thing that I guess got a little bit of play in the media recently as it relates to kidney disease was unfortunately, very sad. Tina Turner passed away. And at the end of her life, she discovered that she had kidney disease and she never knew it. So, I mean, Tina Turner, hugely famous celebrity, right? Clearly money and resources was not an issue for her. How did she not know that she had kidney disease? Walk me through that.
Yeah. So, and I'll just say, I'm a huge music fan. That Tina Turner debut solo album, Private Dancer, was the first album I ever owned. I think my parents bought it for me when I was like 7 or 8. And I was obsessed with her as a kid. I didn't know anything about her story, but she just had such spirit and passion. And so, it's crazy, right? Because her story, while at the celebrity level, it's really a very common story that affects a lot of folks, right? She was diagnosed with high blood pressure like 1978, a long time ago, lived with it, didn't really take it, take on the medications and on perhaps the lifestyle and whatnot that she would have needed to control it. Then she had a first stroke, and that's really when she saw that she was losing kidney function. She was given at that time blood pressure medications, but in interviews later, she said she didn't like the way it made her feel, and she just didn't want to accept the reality that she would need a lifelong medication. And I think that story is right ubiquitous in the population, right? It's crazy that it was Tina Turner, but I think for a lot of us, right, it's just difficult. And so she didn't really address it the way she should have. She went toward homeopathic medicine, and that was not successful, right? Because once kidney disease happens, you can slow the progression, but you can't replace it, right? You can't go back. There's no going back, and there's no cure. And then unfortunately, she had another stroke. She ended up on hemodialysis for a couple of months until she got a living kidney donation, and then overall, though, this took a huge toll on her health, and right, an earlier death than she perhaps would have had she been able to address her blood pressure early in her life.
Yeah, very sad, but certainly appreciate the insight. I mean, yeah, just a very, very sad story. And hopefully for people out there, it helps them, if anything comes of it positive, get the care that they ultimately need. So
Yeah.
let's talk about some like routine tests that you can do, right? So when I think of kidney health, I think historically you think of much older people, right? So for me personally, just I'll bring this home for a second. You may have heard in some of my earlier videos that I actually see a nephrologist, right? So I found out about 2 years ago that I have low potassium. I saw the nephrologist and I have low potassium, low magnesium, and I had to take all these tests. And if you ever have to get a blood gas test, unless it's absolutely critical, I don't recommend it whatsoever. But for people out there who are curious, right, or just want to make sure their health is where it needs to be, are there any tests, any routine tests you can ask your doctor just to make sure your kidneys are actually looked at? Walk me through that.
Yeah. Yeah, for sure. So, I would first just say that, right, when we think about lab tests, remember they're a snapshot in time. And so, right now there isn't a test on the market where we can take one test and know if your kidney disease is going to progress to the point where you require what we call renal replacement therapy, right? Dialysis transplant. And so it's just a snapshot. And so, yeah, there are tests, right? You take your annual exam, your doc should be ordering either a basic metabolic profile or a comprehensive metabolic profile, really just a bunch of basic tests. And from that, we can see either your creatinine or your nitrogen, your blood urea nitrogen levels to see if your kidneys are in fact clearing it. Because if those numbers are high, it shows that your kidneys are not doing a good job filtering out waste products and removing them through urination, right? There's also a urine test. You could just see if you're, we say, spilling protein into your urine, right? Again, a sign that your kidneys are not functioning. And then once you kind of are on the spectrum, we talk about your glomerular filtration rate, your GFR. And that is, usually what we see as far as interventional. When your GFR is less than 60, you have some kidney damage. Once it progresses to less than 15, you require some sort of, intervention to maintain life. But again, these are just a snapshot in time. So you can take that blood test, that urine test one time and be like, oh, I'm early stages, and then put it off. And then, right, it can progress without you being aware of it.
Sure, absolutely. So, two things that you mentioned earlier that I want to circle back on. So, dialysis, right? And
Yeah.
kidney transplants. I was surprised to learn recently. So, we all know that dialysis can be very, very expensive, right? So, for employers out there, if someone's on dialysis, it can be costing your plan hundreds of thousands of dollars per year. But then Medicare has this weird thing, right, where the employer plan will pay primary for 30 months and then Medicare kicks in after that. But going back to the previous comment, I was surprised to hear that sometimes a kidney transplant can actually be cheaper than dialysis. So can you just walk through what dialysis is and why sometimes a kidney transplant may make sense?
Sure. And kudos to President Nixon in 73 when he signed in, this benefit over to Medicare coverage, right? So anyone who is in end stage has, guaranteed coverage through Medicare. And so, yeah, so dialysis, right? It's not just that the treatment is more expensive, right? Because you have to think about it, it's very labor and right, cost intensive. You are going to a clinic, if you're doing in-center, now you can do dialysis at home, but 90% of the country dialyzes at a clinic. Currently in America, other countries have different rates. But right, you have to go there, and it's a 3 to 4 hour prescription, but you have to get there early and maybe wait for your ride. And it really takes a big chunk of your time. And right, we need brick and mortar institutions, but really it's not just the dialysis procedure or treatment itself. It's that, again, the longer that you are living without your full kidney function, there's more and more issues that come about, right? And even dialysis itself, right, contributes to this kind of escalating and snowballing, course of treatment, right? So not only do you have the cost of dialysis, but you also have the cost of more frequent hospitalizations, right? Because now we're accessing your bloodstream 3 times a week, right? So there's a lot of opportunity for infections there. You also have a lot of fluid changes. So there's a lot of risk for being fluid overloaded, having pulmonary edema, right? Having that fluid build up. And so it's really it's not just the cost of dialysis it's thinking about kind of the spider web of conditions that come up once you're on dialysis. Whereas a transplant, right? A transplant might be very costly for the surgeon and the time in the hospital. But then you have a kidney, right? Like, that's the best. That's 24/7. And so over time, you are healthier. You're a lower total cost of care over that life of that kidney. And that's really what it comes down to.
No, appreciate that perspective. And I've always found it very interesting that kidney donors, right, they can actually live and be successful with only one kidney. So that's surprising, but I guess that's how the body is, right?
Yeah. And living donation really right now is is kind of the best outcome, right? That's what we strive for. Although, right, that's not always possible. But in that hierarchy of, outcomes and patient quality of life, it really is transplant and then dialysis. Folks have a better quality of life with a transplant than on dialysis.
So Sara Eve, so obviously you're a registered dietitian, right? And there's that old
Yeah.
adage out there, you are what you eat, right? And I'm sure there's some truth to that. But if people perhaps are younger, right, and they want to take care of their body and their kidneys in general, are there any foods that you recommend eating or avoiding? Would love to hear your perspective.
Yeah, I wouldn't say specific foods. I think, we all have to kind of be cognizant that we are in a pro disease, pro obesity culture, right? Food is very expensive. We have stressful lives, right? It's just the amount of processed food America eats, in general, it's just very easy to be sedentary and obese in the US. You have to take a lot of time and energy to fight that kind of force in America, I feel like right now.
Right.
And so if you are younger or wherever you are in your health journey, there's always room, right, for improvement, and anything you do makes a difference. And so, I just always say, get to the doctor, get your routine screenings done. Be honest with the doc, right? If you're not going to take a medication because it makes you feel like junk, it's hard, but you got to say it, right? If you're not going to follow the diet, just tell me so I know, so that we can work on it. So there aren't especially, foods we think of in earlier stages, but your overall health, your blood pressure, your blood sugars, maintaining a healthy weight, which isn't necessarily your BMI, it can be where you carry it, but, weight, exercise, even walking, and again, having those conversations with your physician, your dietitian, your nurse, and really just being honest about, the struggles you're having, where you need help, and what you can and cannot do.
One follow-up. So can alcohol have a negative impact on your kidneys?
So, right, it's a toxin, right? I think we all, we dress it up in other things, but alcohol is a toxin, right? And so the first thing
Yeah.
when you drink alcohol is your body's just like, oh my gosh, we need to get rid of this. And everything else is kind of slowed down, right? So if you drink it with a meal, you're processing that alcohol before you process your food. And so, yes, it can have a deleterious effect on your kidney health, but overall, there are a few people that end up, that's more of a liver, right? Long-term alcohol use is really going to, cause that liver disease. I think what we see more often is, maybe chronic use of the NSAIDs, right? So if you're taking a lot of Advil or ibuprofen, so you have a chronic backache and you're just taking a ton of Advil all the time, that's a flag to talk to your doctor about, because it's those kind of things that can also, right, affect your kidneys.
No kidding. I did not know that. Wow.
Yeah. Mm-hmm.
So there you
Mm-hmm.
go.
The
So I guess
NSAIDs,
that's
right?
the warning on the back of the bottle.
I know it's funny when you actually slow down and read the warnings. And so again, though, but that's a conversation. People might not think that they're telling their doctor, these things, but you really just got to kind of lay it all out there when you're seeing your doc.
So, Sara Eve, what would you like to see change as it relates to kidney health in the US? If you could change one thing, what would it be?
Oh, one thing. That was a trick question. You opened it up, I got all excited. Yeah, so I think, right, since, there's been very little innovation in kidney disease, which I think is part of the reason the space has been kind of ignored, right? Because we had dialysis, we're like, great, we solved the problem. And when dialysis coverage was when ESRD and dialysis coverage was adopted, we did not predict this population, trend toward obesity, diabetes, cardiovascular. The system was overwhelmed, right? We did not expect this. We thought it was going to be like, 100,000 people a year, and it just wasn't, right? And so I think in the past few years, there's been a lot more innovation and more players in this space. And I think really what we're looking at is, a lot of my work in federal contracting has been looking at, clinical programming interventions for folks on dialysis and getting transplants. But I think we've all realized we need to go much more upstream, right? This needs to be a CKD, right, 1, 2, 3, 4 kind of issue. And that's what I would like to see. And I think there's a lot of population health companies that are doing that, working with payers and providers to do this kind of value-based care, packaging, the services that we can provide for CKD education and interventions. But really it's the upstream work that, where I find most, fulfillment right now, and where I think we're going to see kind of a high tide raising all boats.
We'd love to see that. That would be certainly awesome if that actually happens. So, Sara Eve,
Yeah.
let's say there's someone out there, they want to learn a little bit more about kidney health, or perhaps they want to connect with you directly. Where can they go?
Yeah. Yeah, so I'm very active on LinkedIn. So you can definitely look me up, Sara Eve Schaeffer on LinkedIn. Happy to, have conversations or add whatever value I can there. I'm also on the board of directors for the American Association of Kidney Patients. That's a nonprofit that really, is really focused on patient advocacy. It's completely free for patients and families to sign up. There's cooking videos, support groups, diet education, interventions. There's a patient meeting in September. I would really direct people to the AAKP. They're a fabulous organization that does so much in this space, and it's an open resource really for our families and patients, and even professionals, right, who want to get more involved and do some of the grassroots, intervention and advocacy.
Sounds like a great organization. So, Sara Eve, thank you so much for coming on the show today. Really appreciate your time.
Yeah, thank you, John. I really appreciate it. It was a great experience.
Of course, and for our audience out there, we want to hear from you guys. Have you been struggling with kidney disease? And if so, what treatment plan have you decided to take a look at? Comment below.